Hello there, I'm Dr. Chris and I'm here to talk to you about 7 common causes of miscarriage and how you can avoid them. The first are infections. Now, there are certain infections that could predispose you to losing your baby and you want to be careful and wary of them. Infections like syphilis, toxoplasma, those kind of infections can affect the development of your baby and lead to fetal demise. So make sure you test and screen for those infections at your antenatal. And if you're experiencing fever, foul vaginal discharge, or things of that sort, make sure you get to discuss that with your healthcare provider. The next I'm going to talk about is exposure to radiation. Continuous and prolonged exposure to radiation can put you at risk of pregnancy loss. So it is important that if you are pregnant, you really meet your radiation exposure. And if you have to do any test that involves that, make sure you let the healthcare provider know that you are pregnant so that they can appropriately put that into consideration. Also, if you live within an area that has high radioactive activity, you want to move to an area that you may want to move to another area that has low activity during the time of your pregnancy. The next thing is age. Age actually does play a factor in the tendency or the risk for miscarriage. We have realized that in older women, there's a higher risk. Women in their 40s or 50s, when they get pregnant, there's a higher risk of them losing their babies. Also, women who are much younger, preteens or just teenagers, also have a higher risk of losing the baby. So you want to consider, if you're planning on getting pregnant, you want to plan on having your babies before those age limits. Now, also the number of pregnancies can also be a factor that could cause a miscarriage. So if you've had a lot of deliveries, so you're at a higher risk of having a miscarriage because of what we call cervical incompetence, because the cervix has gone through the process of labor and delivery a good number of times. It may not be able to hold the baby up till term. So if you have had multiple number of children, make sure you discuss that with your healthcare provider so that the best system or the best care can be given for you to carry your current pregnancy to term. Or if you don't want to have those number of children, make sure you discuss with your partner so that you don't experience that. The other thing I'm going to talk about is trauma. Yes, I'm sure you're aware of that. Trauma can be one of the causes of miscarriage. So if you are pregnant, you want to be careful when climbing the stairs. You want to be careful when you go out. Do not wear high heel shoes, which could make you lose balance easily. Make sure you are not with a violent or abusive partner. Make sure you don't expose yourself to any kind of trauma, as that could make you lose your baby. The next thing I'll talk about is medications. There are certain medications that are not compatible with intrauterine life. So you want to always tell your health provider that you are pregnant whenever a medication is being recommended to you, so that they can give you a better alternative or the right dosage that is compatible with pregnancy. Also, if you are on treating chronic diseases like cardiac disease or hypertension, and then you want to get pregnant, you want to discuss that with your healthcare provider before you get pregnant, or even while you're pregnant and after the pregnancy, so that the right adjustment or dosages of those drugs can be given to you in such a way that you do not lose your pregnancy or have to suffer adverse effects of the disease that you are managing. The last thing that could cause a miscarriage is severe malnutrition. Pregnancy is a demanding event on the body of the woman, and so there's need for supplemental for you to take supplemental nutrients to balance the nutritional requirements both for the woman and for the baby. And where this is absent, it could lead to fetal demise. So make sure you discuss with your doctor on the nutritional requirements that you need, and ensure you are taking those supplements all throughout the course of your pregnancy. All right, thank you so much. I hope these tips have been helpful, and wishing you a safe and wonderful delivery from Wella Health.